So this is where the more important things happen. I would like to introduce Richard Peng, who is here from the AAMC today. He is a program leader in ERAS, and he joined the AAMC in 2015 and has extensive experience working directly with learners, medical residency and fellowship programs, medical schools, and specialty societies as they navigate the application process for training positions. Richard has created and produced many webinars, learning resources, and support tools for all involved in the recruitment and selection process. He's actively engaged in community-wide collaborations with other medical education community partners to improve the transition of the entire undergraduate to graduate medical education spectrum. He has a great presentation lined up for you, and so I'd like to welcome Richard Peng. Thank you so much.
Thank you so much, Geneva. Let me go ahead and start sharing my screen here then. Okay. And okay, now that's come through. Thank you again so much for the introduction, and it's good to see you all again. I think it was maybe a few years ago before the pre-pandemic that I last saw you all in the live presentation. But the main goals today is to talk about some upcoming changes for the application content. My main objectives for the presentation is going to be showing how the research that we learned from the Supplemental ERAS application will be incorporated into the ERAS application, how that will impact you as program users on your end in the fellowship realm, especially around the updated experiences section, the geographic preferences, which will be applicable for both residency and fellowship applicants. There'll be, of course, a Q&A session at the end for any additional questions. But as the presentation is going, I'll try to keep an eye on the chat. If there's any sort of clarifying questions, I'll go ahead and address it then and there. But I'll try to keep that limited so that we can keep the presentation going. So let's go ahead and jump with just some overall level setting and stage setting for the overall ERAS strategy and focus. These are the three areas that we've been focusing on the past couple seasons. Will continue to do so in the future. Overall, we're looking at, of course, making sure we provide a stable suite of products and tools that are adaptable to the transition to residency. This is making sure that the application continues to update and meet the needs of the users. Secondly, we want to make sure that we provide data information to you all, and this is to make sure that you can drive decisions in a data-informed way. And last but not least, we want to make sure we partner with leaders in the community who are really doing the research and driving the innovation with regards to tackling our strongest challenges. Okay. So I'll go ahead and kind of make a quick plug here with regards to our second row in terms of data. Around last December or fall, we actually had, or winter, excuse me, we released 5 reports specifically for DIOs and GMEs. This covers those kind of content that you can see on the slide here with regards to applicant demographics, application overviews over the past 5 years, race and ethnicity demographic breakdowns, application status information, as well as some program registration metrics too as well. So these are specifically accessible by DIOs and GME offices, but we do plan to kind of iterate on this and make this more accessible to the other users too as well, and make sure that we tailor the information. For this upcoming season, we are focused more on since we did DIOs and GME for last year, for this season, we're focused more on the advisors analytics. But again, it's iterative and we're going to keep building those out. But again, just a quick plug if you're interested. So jumping into the learned lessons from the past 2 years, you may have heard from your residency counterparts of the Supplemental ERAS application. So the main kind of goals that we have for the Supplemental ERAS application originally were these 3 things. One was to update the questions in the ERAS application and reflect the current context. As you may know, prior to this change, the application hadn't changed for almost 2 decades. There's been a lot of shifts in the environment in terms of medical education and, of course, the transition to residency and fellowship. And so we want to make sure we reflect those changes. Secondly, we wanted to help applicants share more information about themselves and their medical education journey in a more standardized way, and also in a more concise way too as well. And of course, this leads to my third point there. By allowing applicants to share the information in a standardized and concise way, this helps drive holistic review from the program perspective. And when I say holistic review, I mean essentially, I just want to define that as a way to, as a means for programs to really identify applicants that meet their missions and criteria, right? Whatever your attributes, experiences, and kind of qualities of an applicant that you're looking for as a program, we wanted to make it easier for programs to really sort for those applicants in that application. So this was really an intentional iterative approach for the past 3 cycles and coming into this 3rd cycle right now. The first 2 cycles we had it implemented or kind of manifested in the Supplemental ERAS application to really research these kind of characteristics and program signals and geographic preferences experiences. This 2023 cycle was the 2nd year. The 2024 upcoming cycle will be the next iteration where we will actually be incorporating a lot of the kind of experiences into the ERAS application too as well. And in terms of lessons learned, the Supplemental ERAS application itself will be retired for the next season. Like there's no more Supplemental ERAS application. Applicants will be filling in information outside of the system. It'll all be integrated. And this next slide is a general summary of what's to come. So just for those of you who have 1 foot in residency and 1 foot in fellowship, this is just kind of a very clear breakdown of what will be in the fellowship realm. The updated experiences section that we've learned from the Supplemental ERAS application will be incorporated into the ERAS application for applicants for both residency and fellowship. So will the geographic preferences too as well, or geographic information, excuse me. There's kind of other facets to that, but that will also be in the fellowship application. And I know a question in the chat was, will signaling be moving into the fellowship space as well? It may in the future, but not for this upcoming season yet. It's still only for select specialties, even for the residency space. It's not ubiquitous yet. It's still under review and research. So again, just to reemphasize that, I'll be covering the experiences section and the geographic information in my following slides. Okay. So just to kind of give you a little bit more context in terms of how we really drove these conversations and how we involved the community. In the past 3 years, we've got diverse input from program staff, medical schools, and medical students and residents as well. Over 100 different members provided input via focus group sessions, surveys, and of course, looking at behavior too as well in terms of how programs maybe reacted through surveys and applicants too as well. We'll also continue to have evaluation working groups to provide feedback and recommendations, especially around how we produce the research and share that information. And again, we'll continue to collect applicant input too as well. This is especially important for this particular season, for the fellowship realm. Let's say you're going through the season, you notice there's some pieces that you can provide feedback for. We're always a feedback-driven service, so definitely share those with us if you may at that point. Or even now. So moving on to the first section with regards to experiences. Again, these were the main goals. We wanted to highlight an applicant's most meaningful experiences. We wanted to gather information in a way that drives holistic review. And we want to provide applicants the opportunity to more clearly and concisely communicate to programs who they are, what they're passionate about, and what's most important to them. And I'm going to go ahead and shift to this slide right here. These are the general 3 updates that we have for the experiences section. The first column there on the left side will be applicable to all applicants. They will have the option to input up to 10 experiences. This is a little bit different from previous seasons where they had an unlimited number of experiences that they can input into the application. For this upcoming season, they will be able to input up to 10 experiences. They'll be able to provide descriptive information, and for that descriptive information, they can have additional experience types. They can have some primary focus areas that they can select, and also some key characteristics. And I'll show you exactly what those entail in the next couple of slides. They'll be able to briefly describe those activities in terms of responsibilities, contexts, and transitioning to the next column after that, of those 10 experiences that they can input, they'll be able to select up to 3 of those. And when I say that, I mean like literally they'll have 10 experiences that they can put, and then they'll have like check boxes next to them to select 3 of those to say, these 3 are my most meaningful experiences. And they'll also be able to explain in a short essay why they chose those experiences and why it was influential for them. For the third column there, this is only for applicants, if it's applicable to applicants, they can include an impactful experience too as well. And essentially, this is a quick description to really ask applicants if they've overcome a major challenge or obstacle. This might be family backgrounds, challenges, financial backgrounds, community settings, educational experiences, and other general life circumstances that they'd like to share with programs in that essay description. Okay. So let me go ahead and move over to the next question here. One of the main questions that we sometimes get is how did we come up with the 10 experiences? And so this was again driven by feedback with focus groups, those in residency and fellowship, program directors, medical schools too as well. The idea here is that at least what we gathered from this focus groups was that applicants tend to focus more quantitatively on experiences. They just want to pack that experience and kind of proliferate that experience section. And this made it difficult for programs to really parse through that and figure out which were their most defining experiences and who were the applicants were. And so by limiting the number of experiences to 10, the main goal was to have applicants be a little bit more judicial, have more concise allocation of experiences so that, again, not only are they creating a more defined picture of who they are, programs, on the other hand, you'll be able to really sort through applicants based on those experiences. At times, there may have been, in terms of data, looking at how applicants input experiences, we saw as an average of 15 experiences, but as you may know, just statistically speaking, that also ranged all the way up to like 50 experiences at a time, which was, again, not conducive to kind of efficient review of applications. So and then at the conclusion of that, all members really agreed that limiting the number of experiences would really help focus an applicant's time and energy into communicating to programs who they are as an applicant and what's important to them. That last bullet point there is really just a kind of update to the application. The postgraduate training is actually in a separate section of the updated ERAS application, whereas previously it was in the experiences section. It's been moved into the education section instead. Just to clarify, I think somebody saw ask the question if these are replacing the personal statements. You can think of the personal statements as they're still existing. Applicants can still have free reign in terms of filling in a personal statement for their application and submitting them to programs. These are just more tailored descriptions as a part of their experience itself. So moving on to the next piece here. In terms of those new drop-down selections that an applicant can make to really, again, characterize their experiences, whereas these are the 3 columns that I was talking about earlier. So in previous seasons, applicants really were limited in terms of what they can identify an experience type as. They could only identify as work, research, or volunteer service or advocacy. For this upcoming season, they'll actually have those additional bolded items now, so that they can, again, more accurately characterize their experience types. Maybe it's education or training, maybe it's teaching and mentoring. There's potentially, they really want to highlight an extracurricular activity, club, or hobby. Again, it really makes the applicants focus and drill down on their most high-level experiences that they want to define themselves. Additionally, the 2 other drop-down menus that are being added in are primary focus areas and key characteristics. These are kind of the attributes of an applicant or qualities of an applicant that you may be looking for in an applicant, or maybe an applicant wants to share about themselves. Maybe they want to showcase that the experience really was focused on promoting wellness, public health. Maybe it has a technology-based primary focus area, and of course, your usual clinical, translational science, community involvement, and so on and so forth. If there's any sort of, again, qualities of the applicant that you're looking for in terms of experience that they've had in the past, Maybe you're looking for a lot of teamwork and leadership, resilience and adaptability. Again, applicants are kind of asked to really think about what their experiences really, again, in how they influence them in terms of these kinds of key characteristics or primary focus areas. The other piece to this is, remember, the other half of this is making it easier for programs to search and sort applicants. So all of these experience types, primary focus areas, key characteristics, these are all filterable criterias that you can do in the PDWS. You will have additional filters for this upcoming season. If you want to slice and dice your applicants and you're looking for applicants with customer service, primary focus areas, and you also want somebody with cultural humility and awareness, you can sort for those applicants in the application now because they're built into that standardized application. Again, experience type 2 as well. What's not mentioned on here is other kind of pieces too as well. I'll get to it in a second. And yes, they are exportable too as well. This is kind of a representation of the applicant's perspective of what they're filling in. So you'll have your usual experience information, the organization, position title, things of that nature. They'll have the start and end date and the location information too as well. But they'll also have those additional drop-down menus that they can select to fill in. You'll notice two things I want to point out here. One is only the red asterisks are required, right? So those new features or new drop-down menus are still optional for applicants. It just allows them to, again, more descriptively showcase their experiences, but it's not a requirement on the applicant's part. So if that's not something that you're looking for an applicant, I would definitely highly recommend you post some sort of program listing information so the applicants are aware of that. But just remember that this is standardized, so they are able to use this for other programs too as well. Each of these will have little informational icons to educate the applicants on what those sections mean, and we have guidance posted, and also we'll be having ongoing user guide materials too as well to really educate applicants on what these mean. And again, you are able to click on the drop-down menu selections here. Let me go ahead and move on to the next section to show you what it looks like on the program's end. Now you'll see on the right-hand side a screenshot of the PDWS. If you haven't signed into the PDWS recently, this may look new. We actually had some facelifts to the application, to the PDWS early April, earlier this month. So I highly recommend, if you are curious about the kind of updates that we've done to the dashboard, to the application details page, program messages and setup, to sign in now, toward at least right now, while there's applicants in the system, to get a better feel for it. But really, what I really want to show here is just the fact that the experiences section will have those experience types that I mentioned earlier and reflected as such. Okay. In terms of learned lessons, we reached out to program directors and applicants at the end of the season, end of the year in December, and to get a feel for how programs are utilizing the experiences section. And so of those respondents, we found that they were using or planning to use experiences information through the following stages or application processes. The first is 94% of the respondents mentioned that they use experiences as part of holistic application review to determine who to interview. 79% as a tiebreaker for interviews, 87% as preparation for their interview, and 70% thought the experiences responses help them get a better picture of each applicant. I know that, again, these are, because it was the first 2 cycles for residency programs, it's more applicable to that environment where there are high volumes of applications. But at the end of the day, that point here is to really standardize that process so it's easier throughout the experiences of all programs to identify those key characteristics. On the right side there, you'll see the applicant's feedback. More than 60% of the respondents agreed or strongly agreed that the experience types, focus areas, and key characteristic tags allow them to showcase what was important to them. So it was, of course, a majority of applicants that agreed to that, but you can tell that 60% is not necessarily 90%, so there is some healthy skepticism there. It's a new kind of feature for the application, and so again, it's still a process here in terms of making sure we educate and can showcase these kind of experiences for programs. Oops, just going back there for a little bit to pause here. And before I move on, I'll go ahead and pause to see if there's any questions with regards to experiences, or at least I'll check the chat real quick. So the question, I'll just take one and then I'll move on just in the interest of time. Are there word limits for the 10 experiences or the 3 meaningful experiences? Yes. So as I think I showed this earlier. So for the experiences section here, the context, roles, and responsibilities here, that's about, I think, 750 characters. For the meaningful experiences, as they select those 3, we don't want, we've heard from programs where, you know, time is of the essence, it's a valuable resource. You want to capture it as quickly as possible. So those 3 meaningful experiences will have a 300 character limit. And then if you want to dive deeper into them, of course, you can go in context, roles, and responsibilities, which have a higher character limit there. Right then, I'll go ahead and move on to the next section, which is the geographic preferences. So this is, again, a newer concept for you all potentially, but it's part of the research that we've done in the past 2 years. These are the 3 goals that we have for geographic preferences. We want to provide a process for sharing geographic preferences that enhances accuracy and fairness. 2, we want to communicate the importance of geography for an applicant. And lastly, we want to provide an opportunity to share preferences for regions and location setting. And I'll talk about this a little bit more in a bit. But essentially, in terms of the changes for the upcoming application, this will be applicable to all applicants in terms of the option to share this information. The first column there is geographic preferences. They'll be able to select up to 3 geographic divisions. And we're using the US Census Division to indicate if they have a preference for those divisions, or they can select no preference, or they can skip the question altogether if they'd like. They'll also be able to provide a short description for each of those selections, including the geographic divisions and the US, the no preference too as well. When I say no preference, I don't necessarily mean like they don't have any preference for the geography too as well. The main point there to interpret in terms of if an applicant selects no preference is a lot of times applicants may not have a geographic preference and they're willing to work any parts of the US in terms of the institutions that they're going to. And so again, it's just one added level of standardization for applicants to share that information or preference for themselves. With regards to the setting preference, again, this allows applicants to indicate a degree of preference from urban to rural settings, or again, they can either skip this question or they can select no preference, which means that they don't have a particular preference and they're willing to work in any setting preference. Again, they'll be able to provide a short description to explain why they selected that. And the last piece here before I jump into the local standardization is this is going to be in their application, so it's not specialty specific or program specific. They're only able to select up to 3 divisions, and that'll be applicable to all programs. In terms of what you as programs see, you will only see if an applicant has a preference for your division. You won't see the other divisions that they select in terms of the preference. In addition, if they select no preference, of course, you would see that. And lastly, if they opted to skip that question, you would also see no information for the applicant. For our last column there on the right for local location standardization, throughout the application, there might be, this is an update for this upcoming season, there might have been fields in the past where it was free text or it wasn't necessarily standardized, the addresses, hometowns, experiences, education, and training. And so one thing that we did this year was to standardize those particular fields so that, again, not only is there a more uniform way for applicants to share that information, on your end as programs, when you're filtering for that, you can more consistently filter applicants based on those standardized location fields. Now, in terms of what we found for, again, that program director survey and applicant survey in the past, we asked program directors about their geographic preference and how they used it. We found that 94% of the respondents said that they used as geographic preferences as part of holistic review to decide whom to interview. Again, holistic review meaning really just that they consider it as a part of their application review process for with other data points in consideration too as well. 88% used it as a tiebreaker for interviews, 70% used it as a way to prepare for interviews, and 82% actually agreed that geographic preferences help them identify applicants they would have otherwise overlooked. On the right side there, from the applicant perspective, nearly 90% of respondents reported that had they been given the opportunity to report different geographic preferences to every specialty to which they applied, their geographic preferences would not have changed. So again, I'll go ahead and pause to check the chat real quick because I see another one. It goes, if the applicant indicates no preference for geography, is that property that we can filter on? That's a great question. So there will also be filters in the system for geographic preferences. That was part of I can show that to you in terms of what it looks like in the system in a bit. But yes, you are able to sort applicants based on if they had a divisional preference for your program, or if it fit in the same, if it aligned, and of course, if it's no preference to as well. So let's go ahead and move on to the last section in terms of the PDWS enhancements, because I think we're starting to go into that territory. Here are some quick references here. Firstly, the experiences and geographic preferences will be viewable in the applicant details page. So the applicant portfolio will be right at the top for you to see. These new data will be available in filters and exports. So you'll be able to slice and dice the applicants either in the PDWS as you're sorting through your list of applicants or through exports if you'd like. There will be screening options. So if your program feels like you're not ready to utilize some of these data points, you are able to screen geographic preferences at the individual program level. The same way that you can screen demographic information. In the setting or in the setup for PWS, you may know in the past that you can, at any point during the season, screen specific data points. Let's say if you didn't want to see race and ethnicity, you could have screened that at the beginning of the season. Anything that might introduce bias. If you believe that this is something that your program is not likely to use, you can also screen geographic preference to as well. And last but not least, the geographic preference information will be available in the CV and the applicant summary to print. This was just based off program users in the past. Some of them actually printed those out to share with their reviewers, and they wanted to be able to see that information uphand in the application document itself. Okay. So I do want to talk about the overall trend in terms of what we've been focusing on. This is kind of going back to that first strategy point in terms of building a stable and adaptable product. I already mentioned earlier, we've had some modular updates to the PDWS that you may have noticed. Facelifts for the most part. There's some quality of life improvements too as well, and the dashboard applications and program messages. For your administrators, one cool thing about the program messages, there's like a little wild card in there. If you want to do like, dear so-and-so, you can, instead of inputting their names manually every single time, you can just add a wild card. So it just automatically fills it with the applicant's name for bulk messages. Just a kind of small plug there. But what I do want to also mention is hot from the presses, quite literally from yesterday, we actually announced that we are collaborating with Thalamus for this upcoming season in terms of utilizing their suite of products. The whole point of this is 3 counts in terms of allowing programs to get a feel for using the interview scheduler. We want to make sure that, again, that second strategy of data, that we move towards the ability to kind of share data in a more centralized way. And interview scheduling has been one of those areas where, because a lot of programs have different workflows in terms of interview scheduling, we're hoping that this can help kind of alleviate that need in terms of getting that kind of data. And again, just from user feedback to as well, we want to provide, leading markets in terms of interview scheduling tools for our program users. So for this upcoming season, it will be an additional option to use for programs in terms of using Thalamus. It'll be complementary to the rest of the PDWS or ERAS suite. And again, we'll continue to provide more information as it develops. I'm actually going to go ahead and provide the link to our announcement into the chat, as well as an FAQs too as well. So if you'd like more information there on that, it's welcome to kind of browse through that information. Thalamus also has their own kind of training website. It's not a required thing to use Thalamus for this upcoming season, but at this point, it would be a complimentary service. So if you'd like to at least explore that as an option, definitely do so with the resources that we have currently. Go ahead and move on here to my last segment here. Again, the Supplemental ERAS Application, diving back, kind of zooming back out into our main topics here. Now, I've only talked about experiences and I've only talked about geographic preferences because those are the most relevant pieces for fellowship. But again, program signals is something that we're kind of moving towards. This is the third year. This will be the third year that we implemented. We're continuing to increase our specialties. It's potentially likely that it might be incorporated into the fellowship realm too as well. So for those of you who are completely unfamiliar with program signals, I at least wanted to introduce that concept to you. So what are program signals? Program signals offer applicants the opportunity to express interest in a residency program at the time of application. So the idea is, as they apply to programs at the beginning of the season, they're able to signal a finite number of signals to programs that they're interested, general interest in that program. Program signals are intended to be used by programs as one of many data points in deciding whom to invite to interview, meaning that this isn't the end-all be-all way of saying, well, the applicant signaled me, they showed interest, therefore they're the right candidate for me. All it does is at the time of application show that they're interested in you as a program. It doesn't necessarily reflect qualifications. Of course, there's other kind of data points or attributes that you're looking for as a program too as well. It's just one more data point that you can use as a program. It's an optional data point. So moving on from there, and so I got a quick question here is how many programs can the applicant signal? Let me go ahead and kind of, this is more of a curiosity question. Again, it's not applicable to fellowships just yet. I thought I had a slide on, well, actually what I'll do is I'll share with you the current residency cycle. Programs will actually be able to, let me go ahead and pull this slide up then. So again, at the very top there, applicants will be able to provide signals at the time of submitting an application. We're supporting specialty-specific number of signals. So for example, internal medicine in the residency realm have 7 signals that they can send, an applicant can send to their programs, meaning 1 signal per program. They have 7 total, that's it, for that specialty. If they also apply to, let's say, OB-GYN, I believe they have their tiered signals too as well. The last row there, 2 tiered signal systems, they have like a gold and silver signal. Or maybe if they have applied to orthopedic surgery, they would have 30 signals that they can send. So it's a fairly wide range. Specialties are kind of trying out different kind of methods in terms of using program signals to sift through their applications. And what I do want to share here at this point actually is some kind of key takeaways, but mainly I do want to share this kind of recording of a webinar that was hosted last month. And this was a joint AAMC and OPTA Program Directors Association webinar on how different specialties and programs within different specialties view the program signaling and how it worked for them. So it's definitely something that would be interesting if you are interested in kind of learning more about program signals. I would highly recommend that information. And thank you so much. Laurel also just shared a link in the chat too as well in terms of what program signaling looks like for this upcoming year for residency programs. So definitely peruse that if you'd like. Program signals are, again, only for residency programs and the selected specialties for this coming season. Go ahead and once I answer this question, I'll go right back into the presentation to wrap it up. I'm pretty much near the end here. But in terms of the changes, remember, program signals are only for select specialties in residency. Fellowship applicant, the fellowship realm for this upcoming season is only updated experiences in the geographic information. So this is really just kind of A, introduce you to the concept, and B, provide you with resources so that if you want more information on that, you can access that. In terms of key takeaways, here are some key takeaways that we'd like to share. I have it bundled up with program signals, again, just for curiosity's sake, if you're interested in the information. The first is that with regards to the experience types, key characteristics and focus areas, we found in the previous season that there's a variety of those experience types and fields that are being selected by applicants. There isn't just one blueprint that our applicants are using to really just like kind of really focus on. There isn't really any sort of gravitation towards fields. And what this means is to us is that applicants are unique, they are diverse, and the experiences are allowing them to really design their portfolio in a very customized way and standardized way. So this hopefully will translate in terms of the program's end, having the ability to really sort through this information and finding applicants that fit your missions and aligns with criteria and qualities that you're looking for in an applicant. Secondly, in terms of geographic preferences, they are and were working as they were designed to. For the first time, applicants are able to express to programs the divisions or regions of the country where they want to be. Maybe it has to do with support systems that they have near their family, partners, or friends in the area that they want to be with. And this is helping programs by identifying those applicants that they may have otherwise overlooked. So programs who prioritize geography, looking for applicants that are within that have a connection with their community, in the past would have had to kind of guess. You would have had to extrapolate from the data, which is of course part of the review process. But there wasn't a formal way for applicants to express that. And this is the first time that applicants are able to do so. In most specialties, geographic preference, alignment, and no preference. Again, remember earlier I mentioned no preference means that the applicants didn't have a preference. They were willing to work anywhere, essentially. If they had alignment in either that or geographic preference, they result in a higher probabilities of interview invitation. And when considering geographic preferences alone, the highest likelihood of interview invitation occurred when an applicant's geographic preference aligned with that program's location. Just kind of to take a step back a little bit there too as well. I've also heard just anecdotally from programs that the descriptions that applicants provide is also helpful too as well. Because right now we're working just as a general template in terms of the U.S. Census divisions. It may not be as specific as programs would like in terms of the geographic preferences, but the descriptions that are associated with that have been helping programs anecdotally in terms of getting more information as to why they chose those divisions. So just kind of a bit of a side piece there. And then thirdly, just again, additional information for program signals. Those are also working as they were designed and intended to. In all specialties, sending a signal increased the likelihood of an interview invitation. And just like if you keep adding data points that are bolstering an applicant's kind of appeal, when considering geographic preferences and program signals together, the highest likelihood of interview invitations occurred when both the applicant signaled the program and the geographic preference aligned with the program's location. And last but not least, in terms of equity, we of course looked at differences in applicant type, race, ethnicity, and gender, and we found little to no group differences. Okay. So with that, I'm going to go ahead and wrap up the presentation itself with some QR codes. The left QR code there will show data in terms of the Supplemental ERAS application, data and reports, the program director survey that I mentioned earlier too as well. A lot of the information is really helpful, and it's actually broken out by specialties too, and a few of them too as well. I believe interview data in how program signals and geographic preferences kind of played or correlated with interview data will be released in the coming weeks too as well. So again, keep an eye out for that. The middle QR code and the right QR code are just what's new in the ERAS application. And of course, on the right side there, this is going back to a question earlier. A question was asking, how many signals can an applicant signal? That right QR code will give you a table in terms of the specialties and their respective the respective program signals that are allotted for applicants. Just a key note there. Remember what that slide earlier for fellowships. It's only just the experiences and the geographic preferences or information. The program signals are only for select specialties in residency. Okay. And definitely keep an eye out for our communications. That's how we really push out this information for you all. We're trying to get it to you as soon as possible, whenever we can, before the beginning of the season, so that you're prepared for it. And with that, I'm going to go ahead and wrap up the presentation here, and we can transition to Q&A, I believe.
Thanks so much. That was a very informative presentation. I guess one of the questions that I saw in the chat, again, was about geographic preference signaling and sort of how we should advise, residents that are applying to fellowship training programs, so just to clarify it, if they don't signal within our geographic location, would we then not be able to see their application at all? And or can you just give us some more clarity around that? I think that was one of the questions that came up.
Yeah, that's a great question. So let me break it down a little bit. I think the first part is just guidance around geographic preferences and how to utilize that. And the second piece of that was basically like what are programs seeing on their end in terms of the geographic preferences. I'll knock out the second question first. The geographic preferences are part of the application. So you will still get their application even if they didn't signal your division. I want to be clear here. In terms of terminology, prefer geographic preferences and program signaling, two different things. Geographic preferences, if they didn't show a preference for your division, you would still get the application. You just wouldn't see the preference for other divisions. We don't want to have additional bias, right? In terms of like, oh, that student or applicant preferred a different division. We don't want to have that bias against those applicants. If they decide to skip that question, you will also see no information. And when I say no information, I mean for the applicant details page, you just wouldn't see anything for that field for geographic preference. What you would see is if one of the three divisions that the student selected aligns with your program's division, then you would see that preference. You would see an essay, a short essay to accompany that. If they selected no preference, meaning they're willing to work anywhere, you'll also see no preference, and you'll also see, again, an accompanying essay to explain why they showed that, why they selected that. But you would still see the application as a whole, just in terms of that data point. It depends on how the applicant responded. The first part of that question in terms of guidance, I would actually highly recommend, and Laurel, maybe you can share this in the chat. There's a document that we published recently with regards to guidance around program signals for residency applicants, but there's a part in there about geographic preferences too as well. And really that goes to the key takeaways that we had in terms of geographic preferences. And I would offer this kind of bit in terms of guidance to say, we know pretty much on every field and every level, geographic preference is an important topic in terms of reviewing applications, but it's also important for the applicants too as well. It is a criteria that they're looking at. It's just one data point. Maybe it's a very influential data point, but it is one data point that should be taken into consideration of the whole. As I mentioned earlier, similar to program signals, that doesn't necessarily mean it's a qualification. It just means a preference for that particular division. And so I would kind of come at it in terms of that kind of guidance. If you'd like to be true to that, that's probably the best honest answer that we can give, because this allows programs to see, oh, you actually do have a gravitation towards that particular division. If it aligns with them, as you can see in the, as you mentioned, as you heard earlier in the takeaways, it increased interview invitations for those particular applicants. And of course, at the end of the day, this is just one data point of many.
Thank you for that.
Yeah.
There's another question that goes back to program signaling, which is there any anticipated date where fellowships would be getting program signaling? We know it's not coming this upcoming recruitment season, but any sort of forecast on when that would be part of our applications?
Yeah, so it wouldn't be a part of this upcoming season. If it gets incorporated into the fellowship realm, it will likely be the next upcoming season. And similar to how we've been pushing these communications out, I think the earliest we kind of pushed out communication was basically the end of the year last year. So you'll have a full year to kind of prepare for it. And when I say the year, end of the year, I say around like December, November. I think that's when we first announced it. So we'll try to mimic that for upcoming season and try to give you as far advanced notification that it is coming. Again, this is just kind of laying the groundwork to say like, hey, like program signals are being used in residency realm. It might be incorporated into fellowship world. But one thing that I would want to add to as well in terms of that is even if we do incorporate it into fellowship realm, remember that we want to make sure that we protect not only the applicants in terms of what information they can share, but also we want to preserve the workflow that you have as fellowship programs too as well. There will be that screening feature. So if you're as a program, you decide not to use it, that'll still be carried forward. But again, in terms of timeline, I just anecdotally from what I'm saying, we try to push it as soon as possible, but try to keep an eye out for communications or maybe some webinars that we post announcing those updates, typically around December or maybe earlier in the year next year.
Thank you.
Any other questions? I think I saw a question in terms of the thalamus piece. It goes, is it complimentary for a limited time? And if so, will it show what it would cost to continue? So it would be complimentary for, let me go ahead and pull my notes up there. So it would be complimentary for this upcoming season. So no cost there. The idea is the target is for the following season, the 2025 season, the Thalamus interview scheduler would replace the ERAS interview scheduler to help programs manage their applicant interview process and improve the interview experience. And so it would be at that point, I think that the decision would be made. I don't want to lock anything down in terms of the leadership decisions in terms of cost analysis there, but again, I believe the idea there is to replace the interview scheduler, which should not be at additional costs. I'm personally not sure about if there's additional features in the Thalamus interview scheduler that may come at a cost, but that's something that we'll again try to make sure that we relay to our program users. And I think I'm seeing a few questions too as well.
Yeah, I think there's still some more dialogue about the geographic preference. You know, if candidates don't signal to us or don't signal our geographic area, you know, how much how that would be interpreted.
Right. And so that just goes back to earlier what I was saying, that this is the first time that applicants will be able to even share that geographic preference. They do have the option to select no preference, which programs will see, and that should be interpreted as that the applicant is willing to work anywhere in terms of the institution's locations too as well. And if they select a different division, you won't see that, right? But they see it selected your division, then you will see that preference for your division. You just wouldn't see the other two in terms of the divisions that they selected. And if they did not select it, or if they skipped the question, then it would show up as blank.
I think the question that we're going back and forth in the chat here is that since it will look to us the same as to whether they signal something else or they just leave it blank. It seems like people shouldn't leave it blank because we're going to make the assumption that they've signaled something else, right? Which to those of us who get a lot of applications, we're going to be like, oh, blank means not us. See what?
Yeah.
Correct?
Yes, I can we definitely heard that sentiment in the past before. I think the point there too as well is just kind of fear that the applicant will be missing out if they didn't signal your particular division or another division. And that's kind of goes back to the whole point that they have up to 3 divisions that they can select. And so it's fairly broad there. That's one. And second thing too as well is remember there's that description too as well that'll help them. But it is really something that has, in terms of the data, help the applicants really show they have a preference for the division. It just works in tiers.
Don't get me wrong, I'm
yeah.
fine with it. Like, I get a lot of applications. I just, as long as they know the rules, I think that's okay. They just have, as long as I just want them to understand the rules, that like leaving it blank has some implication. It's not like, I don't feel like bothering. It's no big deal. It may be a big deal to leave it blank. That's
yeah,
all.
and our recommendation, and again, you can see in our guidance that is be in terms of the geographic preference, be true to what you'd like to include there. If you really have no preference, it's like no preference. If you have a preference for geographic preference, then it would again accent your application in terms of what you're portraying to program. So definitely agree. Yeah, I agree.
Yeah, so it seems like saying that they have no preferences is a better alternative than to just skipping the question entirely.
Right.
And then not giving us any clarity on that.
Mm-hmm.
Okay.
Question came in. Can an applicant select 2 divisions and then also no preference? No, so they would either select the 3 divisions or up to 3 divisions, or they can select no preference. They can't select both no preference and then a division 2 as well. Because remember, I was mentioning earlier, that geographic information is built into the biographic information section for the applicant, so it's part of their application. And it's not specialty specific. So it's not like they can kind of change their preference based on which program they're applying to or specialty that they're applying to. It's a universal part of their application. Okay, thank you. Any other questions? And I am not sure if I shared the census divisions. As I mentioned before, it's a bit broad right now because it's based on the census divisions. But the idea is that we'll continue to iterate on these application changes. As I mentioned before, we want to keep it adaptable. We don't want to just say, well, after 20 years, we made a change. We'll wait another 20 years for it to change again. We want to continue to take feedback from you all and continue to improve the application too as well. And so this is kind of one of those pieces. Well, I'm not sure if you're able to find the map, but I can also share that as a follow-up if people are interested in what those divisions are.
Great. Thank you so much for this presentation. It was very, very helpful and gave us a lot of clarity around things that weren't quite clear to us before we started. So we really appreciate your time with us today, Richard. And thanks, Laurel, for being in the chat and so also fielding some questions around sort of the intricacies of the ERAS application. So thanks to all of you for joining us today. Don't forget that if you're coming to ATS, we'll be meeting on Sunday afternoon. I'm looking forward to seeing you all there. And again, if you have topics for the 2024 annual conference, please make sure to submit them before June 5th. Thanks again, and we'll be seeing you soon.
Thank you so much.